Hello and welcome to a very special episode of Taking Control of Cancer, the podcast brought to you by the North East London Cancer Alliance. I'm Steve Bland, and in this episode we're celebrating the role and explaining the role of the clinical nurse specialist. And that's because on March the 14th it is National CNS Day, and that's a day that's all about celebrating and raising the profile of this incredibly important role. In this episode, we're going to hear from a number of people. In the first part, we're going to hear from Kate Williams, who's the Macmillan Cancer CNS Development Lead, and Yvonne Beadle, who's the Programme Manager for Personalised Cancer Care and Workforce here at the North East London Cancer Alliance. And in the second part, we're going to hear from two CNSs. That'll be Kim Grove, who's the lead neuro-oncology CNS at the Barking, Havering and Redbridge University Hospitals NHS Trust, and Chelo, who is the upper GI lead a CNS in the same trust. We're also going to hear from Peter Adams, who's one of Chelo's patients, who can tell us all about just how important these guardian angels, that's his word, guardian angels are. So we'll start off with Kate and Yvonne, and I began by asking them just to explain what a CNS is and why they have their own day.
Kate, why don't you start with what a CNS is, and I can perhaps follow up with why we're celebrating it with a national day.
So a CNS, Cancer CNS is a specialist nurse that works in cancer. They generally are a nurse that works for a particular tumour group, which is like a particular type of cancer, and they follow that patient through the pathway of all their care. So quite often they will see them at diagnosis or maybe even before diagnosis, and they support them all the way through the journey, through their cancer, sometimes to their sort of terminal care. They also are there as their advocate, their key worker. They are also support for the patients and family, and make sure hopefully the cancer journey is smooth, and in a difficult time it's very well supported.
So that's who they are and what they do. Yvonne, why don't you I mean, I guess, there are so many wonderful people working in a cancer pathway. Why? It's a silly question because actually Kate's just explained all the amazing stuff they do, but why is there a National CNS Day?
As you say, Kate's really eloquently explained what they do, and they're absolutely an integral part to supporting patients at what can be and often is a really, really difficult time in somebody's life. And I think there are recruitment and retention issues within the CNS workforce, and I think the CNS Day, the National CNS Day, which came about a couple of years ago, was one about recognising the wonderful work that our CNSs do and the role that they play in supporting patients, and celebrating that, and an opportunity to really kind of talk about, recognise, celebrate the work that they do, but also secondly, really to raise the profile of cancer CNSs, to talk about what a rewarding job it is, to attract people into the profession, to explain a bit more about what cancer CNSs do, because I think it's not necessarily clear to the general public, or potentially to kind of aspiring new nurses coming into the nursing workforce, about what it is to be a cancer CNS. And I think sometimes it can be a bit scary to think about going into cancer work. It can be a bit daunting, and the perception can be that you're supporting people who potentially have are going to die from their disease, but that isn't necessarily the case, and it's a hugely rewarding career, and there are lots of benefits. So I think part of what National CNS Day is about kind of dispelling some of those myths, telling people a bit more about what CNSs do and how rewarding a job it can be.
Well, let's explore that then. If someone's listening and they didn't really know what a CNS was, and they think, maybe working in cancer is for me, but you're not sure kind of, what path to go down, sell the career as a CNS, then why is it such an amazing job? What might you be doing? What would a CNS do? I know Kate's kind of touched on a couple of the bits, but what might the job involve? What might the different roles involve? Because there are lots of different roles as a CNS, aren't there?
I am going to pass that to Kate, because Kate is a CNS by background and I'm not. So Kate, tell us what that's like and how rewarding that can be, and the benefits of being a CNS.
So being a CNS is an amazing experience. It can fit in all different categories. So you can make a CNS role really to what you want it to be. You are there to support patients and families. You are counsellors. You are sometimes a friend to that patient and family, because sometimes you can be supporting those patients for years. You're also someone that can set up support groups. You can do signpost them to health and wellbeing events. But you also can advance to more expert jobs like advanced nurse practitioners, and then go on to even nurse consultant roles. So there's a huge amount of work that can go into a CNS role. You can do nurse-led clinics. You are there to sort of do procedures sometimes. So there is such a huge element that can be covered. And I think with the nurse specialists, we do so much different elements now that you can't get bored in that role. There's so much elements to it, but it is very, very rewarding role.
Every day must be completely different.
Absolutely, yes, definitely. Yeah.
So lots of stuff that you might, consider being sort of traditional nurses roles, but then a lot of the extracurricular stuff, the stuff outside of maybe the treatment, that I've always kind of felt, can get overlooked a little bit, can't it? Because you're so focused on the treatment, and you're talking about, booking appointments and support groups and all that kind of thing, that maybe, takes a different kind of skill set, would you say?
Yeah, I think it's about looking at the patient as a whole, in a holistic way. So we know that in cancer, it's not just about the treatment, it's about their health and well-being, it's about their mindset, it's looking at their age, whether they're lonely, whether they're young, where they've got other issues like children, families to support. So it's not just about the physical treatments. There's a whole load of elements that go on top of that as well that we need to consider. And we do know that prognosis about support and people's mental health and things actually is improved.
Kate's got the cleaner in
Got
at
the
the
cleaner.
office, haven't you?
I am so sorry.
I could just hear like somebody was like moving house next to you or something.
Hoovering.
So yeah,
Thrashing around.
I'm so sorry, he's gone now.
Sorry, Yvonne, you were going to come in.
Yeah, I was going to just add to what Kate was saying about really supporting the patient holistically. And I think that's what's so lovely about the CNS role. It isn't just about their kind of clinical treatment. It's also about considering and supporting and talking with it's that kind of what matters to the patient, what matters to me, conversation with the patient. So not just about the treatment and what's happening, but actually what else is going on in that person's life that cancer is impacting on, and how and what additional support does the patient need that supports them to have a better quality of life, supports them through that treatment, but also sometimes has an impact on the treatment and outcomes as well. I mean, if you think about it, having cancer can impact on your income and your financial stability, and your CNS can signpost you to financial advice and support, can signpost you to grants, can signpost you to charities for additional financial advice, and that can help you then pay you potentially, if you haven't got money to travel into the cancer centre for your treatment, or you haven't got money to pay the additional heating bills so that can have an impact on your overall outcome. So I think it's really important to stress those additional needs, that those holistic needs that cancer patients experience. Kate touched on some of the other ones, that kind of psychological and emotional support that people might have, or kind of issues beyond clinical needs at home, maybe around housing, or what support might be available in primary and community care as well. And your CNS is your kind of key worker that will have those conversations with the patient and join up other services, will kind of outreach out into some of those community services, those peer groups, the third sector, etc., that can all kind of wrap around the patient and support them through the cancer.
What kind of skills do you think are required by a good CNS? What kind of person are you looking for when you're talking about recruitment? What kind of skills do you think go into someone who would thrive in this kind of role that I'm sure is really challenging, but like you say, so rewarding as well?
I definitely think communication is the key thing. You've got to be able to communicate. If you can't communicate and sort of liaise with people in quite a broad manner, because sometimes you could meet a patient and they don't want to talk about cancer, so you've got to learn to talk about other things. So it could be
you become an expert in all sorts of things.
Oh yeah, you can talk about football, you can talk about their children, you can talk about the animals. You have to have like that sort of ability to actually adapt to each situation, to each culture, each religion, everything they need, because everybody is very individual and they've got individual needs. So that communication, I think, is key. The education comes next to it. You obviously need to be sort of educated to a reasonable level, because if you're putting that name as specialist next to someone's name, they need to be educated to be able to give that information. But yeah, the key I always think is communication.
Yeah, I'd agree with you, Kate. And because there are times when you have to have really difficult conversations with patients, or like you've said, Kate, kind of navigate to kind of finding those levers and those things that will help a patient to open up. And it might be a conversation about football, or it might be a conversation about the family that starts out as a chat almost, but then helps to kind of actually unpick some of the things that might be impacted by the cancer diagnosis, or might be impacting on their ability to actually kind of adhere to their treatment. And sometimes there are really difficult conversations to navigate within that. So it's really important the CNS has kind of good communication and doesn't shy away from some of those difficult conversations as well.
You both mentioned the family. How much of the role is also supporting the people around the person with cancer?
I think the family is very hugely important, because you can't forget when someone's diagnosed with cancer, that has an impact on everybody, whether it's their partner, sometimes their parents, it could be their children. So I think when you're dealing with a patient, it's the family you're dealing with, and you're managing their expectations as well as their patients' expectations.
Because that was something that in my experience, when my wife Rachel was ill, was that I never really felt like anybody. Not that they weren't bothered. That's not fair to say they weren't bothered, but obviously the focus was all on her, and I was a bit of, oh, and we're kind of here for you as well, and we'll support you, but you're back to her kind of thing. And it was never really, never something that I kind of felt that supported in. And I think I don't know if we had a CNS. I wouldn't be able to tell you. This is going back 6 or 7 years now, 6 years or so. And But I imagine it would have been something that sounds like it would have been really, really good for us. It is such a trauma for everybody, not just. And actually, my Rachel used to say that in some ways it's easier for her than it is for people on the outside, and I think having the support of someone like this, I think I would have found incredibly useful. Why do you think though that, given all of that, and given it sounds like a really rewarding career, you mentioned it at the start, Yvonne, why do you think you are having um, challenges with recruitment?
There are workforce challenges across the NHS generally.
Yeah.
I think within cancer, I think there can be a perception that it's not a sexy, attractive field to get into. It can be quite emotionally traumatic for nurses. Sometimes it can be hard, and I think sometimes people are frightened of the specialism as well, associated with being a cancer nurse. But also that kind of how to get into, I think sometimes it's not clear how to get into cancer nursing, what that kind of career pathway looks like, and as well as opportunities kind of early on in people's careers, or even in undergraduate kind of nursing degrees, that how much conversation or education and training there is, and Kate will be able to speak better to this actually, of cancer. So kind of knowing how to because it is an enhanced role, it is a it's not something that you get into straight away, but it's finding your way into that, and demystifying some of those kind of preconceptions about what it means to work in cancer, because as Kate's described, it can be hugely rewarding, and the kind of relationships, quite often quite long-term relationships that you establish with your patients, can be really rewarding as well. So Kate, do you want to add a little bit to that?
Yeah, so certainly my role now, working with the nurses and meeting nurses that are aspiring to be cancer nurses, it's confidence. Sometimes it's confidence and making that leap of faith. It is, as a role, quite an isolating role in some areas where you're working very much on your own. So to make that transition from a ward nurse or a day unit nurse is quite huge. It's quite scary, it's quite isolating. So sometimes they come into these roles, and because they don't feel supported, they leave. Or it's like the whole package of supporting the nurse, the emotional burden, the workload. But we do have things like clinical supervision and things like that, and it's getting them to engage with those sort of things to actually offload, but making sure they are very supported in their role. So it is, sometimes it's that leap of faith to take that role, and sometimes they don't feel they're qualified enough, so they don't apply for these jobs because they feel they're not ready. So it's trying to attract them and actually give them that confidence to actually apply for these roles and actually make sure they're supported.
And that's where your role comes in, isn't it, Kate? And that's where the project that Kate's working on is, it has, because we've recognised that as a system, as the people, kind of some of the people that are trying to attract more nurses into cancer, recognise that, as Kate said, sometimes it's not clear how to get into it. People aren't confident about their abilities or what to expect, or sometimes do feel isolated or unsupported. So part of Kate's role is to offer some of that dedicated support to new cancer CNSs, to kind of walk them through and those that are aspiring or interested in getting into cancer, to kind of show them what opportunities are available, show them what kind of training or additional education they might need and where they can access it, and then when they're in role, providing kind of mentoring and coaching and support to those newly qualified CNS is to really help them kind of embed and grow that confidence and develop those skills that we talked about right at the beginning.
Yeah. So if I'm at home listening to this and I'm thinking that sounds like a really great opportunity, a really great field to be in, like you say, so rewarding. I can absolutely back that up. Some of the most like incredible people I could ever have imagined meeting are through the world of cancer, and it's sometimes heartbreaking as well, isn't it? But I think that makes it even more rewarding in a way. But if I'm sat at home thinking that sounds like something for me, how do I become a CNS? What's the route in? How do I apply?
Kate.
So
Kate.
So the problem is there isn't one route in.
Yeah.
So a lot of nurses come in working through a chemotherapy day unit role, or they come via oncology wards. So they start on the wards, and that's how I got into that role. I worked on a ward, then I was a chemotherapy sister. So that's how I got it. And a lot of people come that route. But then you've also got the other route, that you've got the nurses that come through their specialities. So like, for example, a skin specialist for cancer will come sometimes through the clinics that they're working in, dermatology clinics. The gastrointestinal nurses will come sometimes through endoscopy or the gastrointestinal clinics. So they come from all different avenues. And it's about sort of like, when they get there, making sure that if they haven't come from a cancer sort of area, we develop that education because they've got their speciality. And if they've come from a cancer background, we develop their specific site-specific tumor areas that they're working with. So there isn't one avenue in there. It's just about sort of directing them in the right ways and actually making them think, what do they want to do? Because there's a huge amount of roles in cancer. Besides the nurse specialists, there are research nurses, there's huge amounts of clinical trials. So yeah, so it's directing them to what their passion is.
And I think passion is a really good word, isn't it, Kate? It's kind of fun because there are so many different opportunities and routes and kind of career pathways. I think key is kind of, as an individual, what are you passionate about? What are you interested in? And then we can kind of help develop that and support you in that pathway. And Steve, this will be slightly boring, but one of the pieces of work that's been happening nationally is around a career framework in cancer, which spans from kind of entry level, from your unregistered workforce, so things like cancer support workers, all the way through to your nurse consultants and your kind of cancer and AHP, your nursing and AHP kind of leadership roles. And this is something that NHS England and Macmillan and a number of other stakeholders have, the Royal College of Nursing and UCONS have kind of developed a career framework to help to give that framework of what are all the different kind of roles and jobs within cancer, within nursing and AHP, allied health professionals, and depending on what my interests are, what kind of learning and education do I need for particular types of roles or levels of practice? Where do I go to get some of that education and training? What are the kind of competencies and capabilities at each level? And Kate will kind of some of the work that Kate's doing, that only began at the end of last year, is to support some of those development, those newer CNSs, to kind of work through that framework. So it gives a pathway, and it describes what that looks like for people that are interested in it. And that's, I'm going to read this because I'll forget it. It's called the Ascend Framework, which stands for the Aspirant Cancer Career and Education Development Programme. So it is a bit of a mouthful.
But that's important, though, isn't it? Just to kind of wrap up, as Kate said, one of the challenges is feeling supported, and I think, probably in a role like this, when you're working with some of the people that they're working with, having the support for them on a personal level, I guess, as well, is massively important. And it sounds like so much incredible work is going on, and I hope anyone listening will think it's a career worth pursuing, because it sounds incredible. Thank you so much to both of you for joining me.
It's our pleasure, Steve. Thanks for having us.
Thank you ever so much. Thank you.
So that's some of the bigger picture stuff, some of the work going on across the Alliance, some of the support the Alliance gives to CNSs. Let's talk now to two CNSs who can tell us a little bit more about what the role involves. Kim Grove is the lead neuro-oncology CNS at the Barking, Havering and Redbridge University Hospitals NHS Trust. And Chelo Boo is the upper GI lead CNS at the same trust. We've also got Peter Adams, who is one of Chelo's patients. Let's start with you, Peter, if I may. Really tell us a little bit about your story and how you've come into contact with Chelo.
Well, basically, in July last year, I was diagnosed with a tumour to my throat. Basically, I went through loads of tests to start off with, and then I got introduced to my surgeon, Dr. Mukherjee, and then through the process of going through all the stages, I was introduced to Chelo.
Peter, what were you introduced to Chelo as? What were you told? This is the person that's going to fix. Going to sort this out for you. What was the kind of sell when you were introduced to Chelo?
Basically, anything I needed to know, speak to this lovely lady, because she basically knows everything. And if I or the wife had a question, we just knew to ring Chelo, and she would answer it straight away. And if she didn't know, which wasn't very often, she used to go out and find the answer and call us straight back and put our mind at ease.
What a unbelievably important role. So, Chelo and Kim, like I said, in terms of you guys, let's start off with what is a CNS, and Peter's just kind of explained a little bit. You guys fix and sort everything, don't you? You just basically you make the lives of patients an awful lot easier. But give us your take on what a CNS is, Kim, first.
So yeah, hopefully that's what we do in a nutshell. Hopefully,
yeah.
But I think it's supporting cancer patients from start to finish, really, from the beginning of their journey, when they don't even necessarily know they've got cancer, right through, in my case, and I'm sure probably in Chelo's, from them having surgery to having treatment to them being on, perhaps being monitored and without any treatment, but on a surveillance type of scenario, providing support, psychological support, sorting things for them, navigating different services, and discussing their treatment, helping them understand the medical jargon along the way, those type of things, I would say. What would you say to Chelo?
Right. Yeah, you're right there, Kim. I think you mentioned everything what we do. But of course, Peter, basically Peter was been introduced to us by Mr. Mukherjee. So basically that's what happened. So when Mr. Mukherjee told me, like, I got patient, we discussed in our MDT, patient needs know everything, but we have to do more things about, like, coordination of more investigation that Peter needs, then yeah. So there and then, after knowing Peter, call Peter, family, introduce our service, what we do. So kind of thing, really like coordinating all what he needs um during diagnostic investigation, and then go through, by piece of going to the adjuvant or chemo or surgery or whatever. So it's kind really of, we are here for like an expert support for the patient and clinical leadership guide. And of course, we have this kind of, I would say, advanced clinical knowledge, educate the patient what we're doing, explain it to them what we're doing, because it's not just because, okay, I got cancer, but the patient needs to know and get involved in their care. So yeah, that's what we do.
Like a bit of a guardian angel, Peter.
Yes, she has been. It's
The thing
basically
is,
whatever you need to know, just ask, and these young ladies can tell you everything. No, it's true, and you've made my journey so much easier,
oh,
because
Thank
where all
you.
the words that I don't understand, you tell them back to me in layman's terms, so we can understand them, and it's makes life so much easier, and just getting all the right information as well, not being told things that you would find on the internet. Was
mm,
Yeah.
one thing Dr. Mukherjee said to me: do not look at the internet. I'm
Or
your
Dr. Google.
surgeon. Yes, he said, I'm your surgeon. I'm going to keep you alive. You listen to everything I say, and anyone who is with me, they will give you all the right information. Just do not listen to what's on the internet.
we also have quite a big role in coordinating everything. So when patients are actually referred in, as well as obviously our very close relationship with our patients and our relatives from a supporting psychological, even physical point of view, we have to ensure that that the pathway is being managed all the time, and that they're not lost in that their surgeries, they're still in a list to be operated on, and that we keep a track on where they are in their actual journey, so they don't sort of get lost, if that
Yeah.
makes sense.
Yeah.
And we keep bringing them back to MDT. We make sure they're seen by, so when they've had their diagnosis, it's our job to make sure that they're very promptly seen by either a consultant, or some of us do the results ourselves, and then we very quickly refer them to an oncologist and very quickly get their treatment sorted out. And from our point of view, I'm not sure if Chelo's the same, but we're a regional unit, so we have to make sure that our patients get referred back to their local teams very quickly, so that we don't waste any time really, and that we get on and treat these patients in a timely fashion.
Yeah.
So I suppose we're very much a coordination point of sort of a person that's there, pivotal to making sure that everything runs smoothly.
Oh, Peter touched on something a minute or two ago when he said about words that, as a patient, you don't understand. Particularly, I mean, I can relate to that, particularly in the first couple of weeks, the first few weeks after a diagnosis. Your head is just in a spin, isn't it, Peter? You don't know.
Oh,
You,
definitely,
you
definitely.
don't know which way is up. And you're getting terms just thrown at you, and
Mm.
you've got to be here, you've got to be there for this scan and that scan. It might be this, it might be this, it might not be. You're just in a whirlwind, and having somebody like these guys to guide you through that, hold your hand, Peter. It must have been a massive help, kind of practically, but also your massive reassurance in terms of knowing that you were in safe hands.
Oh no, definitely, definitely. It just makes it a lot smoother journey, knowing that there's someone at the end of the phone who can help you if you're going a bit, like you say, it's a head buzz. You don't know what is going on. You're trying to come to terms with the cancer bit, but then you still, I don't know what the word is. You're still trying to go in the right direction, and sometimes you waver off. But as I say, these ladies sort of, they've got everything planned out for you. It's
Yeah.
it's a pretty straightforward journey, and they make it a lot smoother because they do all the work.
And actually
No.
thinking about your health,
Mm.
your health is enough to think about
Oh
actually in that
yes.
period, isn't it? And
Yeah.
and then you layer on top of that all the other things, any financial worries, appointments, like Kim was saying, advocacy about making sure you're being seen at the right times and everything is
Yes.
happening in the way it should be. There's
Mm.
so much more that goes into it that maybe, anybody who's listening who's not been through a cancer kind of journey wouldn't appreciate everything that goes into it and everything that sits like around the actual treatment bit.
Oh no, it's mind-boggling because you're trying to plan things, but it's all being sorted for you. Whereas you used to do it yourself, but
Yeah,
now
of
you've got
course.
someone there who's
Yeah,
doing it for you, which makes it so much easier.
yeah. So can I? But yeah. So what happened is, as soon as we know you, Peter,
Yeah.
I have to study yourself. I have to study you. So I have to
Yes.
get all my information. This is Peter. Now I
Yeah.
want to see Peter, how Peter at home, what kind of thing that Peter needs. I got the holistic assessment and making
Yes.
sure my Peter is brilliant to go ahead of my plan because I got a plan for a patient. Okay. So
Right.
I got an outline, what kind of thing. As long as I've got all this information, I need this one. I got a plan what I'm gonna do. It's like bang bang. I got a pathway to do my patient
Mm.
individually because of course everything is different. So each patient I got my own kind of, it's personalized. Okay. So I only know you without seeing you. I know
Mm.
inside you because we do our meeting and everything about that. So I know your bloods and everything. So I haven't seen you, but I'm so positive you can make it. So I've got already planned ahead. That's why you said like, okay, Chalo. I said before calling you, I've got already what to do an assignment for. So that was a very good one. I always got a plan. So we're very quick, and as soon as we got everything that we, yeah. So you are a very in that time. I think you help us as well a lot. It's not just the nurses, but the patients' cooperation, patients' availability, and all. It's all like working together. Because
Yes.
if you don't, because say if I talk, I will give you some education. And if you're not listening or if you're not interested, because of course, psychologically, emotionally, but we always say be positive because we can do something.
Mm.
All right. So that's it. It's not just only me, but I'm very grateful as well that you are as well there to help yourself, which is the best thing that we
Mm.
always we do this is what we do. And whatever you say about us, I didn't even expect that I did the best thing that for I didn't do that like, oh, I want to please my patient like that. No, that's what we do. And I think it's very natural what we do.
Good.
That gives you a bit of an insight into the relationship that you guys have, Kim, with with your patients. That I imagine must go far beyond like simple sort of nurse or doctor with the
Yeah,
patient. Like it goes
Mm.
goes
we're
far
very
far deeper.
we're very privileged really because we have quite a sorry, we have a very special relationships with our patients and especially their families, especially in my case because my patients have brain tumours. So we get some of our patients are unable to call us sometimes or articulate due to the nature of
Mhm.
their illnesses, really. So their families take that responsibility on. So we get really, really close to our relatives and our patients, and we. I suppose it's a different relationship than you would get as a ward nurse because your patients come and they go, but we keep our patients forever, really.
Mm.
So we are very privileged in that respect.
Peter, how would you describe your relationship with Chelo?
Oh, she's like a sister.
Mm.
No, she's just helped in so
Like
many
the older
ways.
sister
And
that tells you off a bit, and
The older sister.
the older
No,
sister who sort of keeps you in line and
Younger
no,
tells you off.
sister.
And
Yeah, yeah.
definitely younger sister.
I don't mean
I'm,
that you're older, Cello. So
I,
that's
no,
not what I was
listen,
saying. I mean in terms of the dynamic.
No,
it's
it's
okay.
just Cello is so easy to speak to.
Yeah,
Thank
It's
you.
not hard work. It's not hard work. It's enjoyable because you come away feeling at ease. Yeah, I've got
yeah,
a lovely wife here who's Cello knows very well because she's been to very many appointments. So yeah, she's my little personal assistant. And Cello's my other personal assistant. She's just yeah, so helpful. It does. It makes the journey so much easier when you've
yeah,
got someone nice at the other end of the phone, and
yeah,
they understand the way you are feeling. They
yeah.
know everything, and it it just
Oh,
makes life so much easier.
Yeah, I was just going to say, I would hope that for a patient and even for a family member, because we know the patient so well, they don't have to repeat everything all over we know them.
Yeah.
And if they're slightly different, say for instance, for one of my patients, if I'm talking to them, but I can hear in their voice that actually they're talking to me slightly different to they were last week. We
mm,
know that you don't need to go through everything over and over again because we're
mm,
familiar and they're
yeah,
familiar to us, if that makes sense.
yeah, of course.
Peter, how would you? You mentioned your wife a couple of times there. How would you say that Cello has helped her specifically?
Um, just by relaying information, and it's just uh, we, we're knowing what's going. My wife's a personal assistant at work anyway, so
Right.
she takes loads of information, she reads through everything, and it's just having everything documented out in appointments when I've got to be there and everything. And yeah, she's made my wife feel more comfortable as well.
Yeah. So I would say the wife or relative are very important part of your journey, Peter.
Mm,
And to be honest with you, when because I used to be a chemo nurse, I always wanted to speak to the family, whoever looking after you, because they'll be the one your mainstay when you're not well.
mm,
Yeah.
yeah.
So any information or anything like that is gonna be the best person because say for instance cooking your food or something, you might not going to remember what is the food that you need to have while you're having chemotherapy. And the
Mm,
wife is there and I want to make sure that she does know things too. So they're very important and they're very included of everything. It's not for all patient but the supporting, relative are important too. So they're always.
um, this is one for Kim and Cello. Um, Part of National CNS Day is raising the profile of the role, to help with things like recruitment and things. I wonder how did you two end up becoming CNSs? What's your nursing journey up to this point? Kim, you crack on
Yeah,
first.
sure. Well, I'd nearly always worked in neurosurgery, and I worked in various different jobs, different roles, neuro ITU and neuro as a ward manager. And then this role of a neuro-oncology CNS and starting up a service came about, sadly to say, 20 years ago now.
Right.
And it was a new role. There were several, I should say, cancer nurses in breast cancer and prostate, etc., in the main cancers. But in brain tumor cancers, there were very few, even nationally. So this was a new role to the trust, but also in Essex as well, because our unit covers our local population, but also Essex as well. So I thought that it would be a nice challenge for myself. It was also at the time of promotion, and it was Monday to Friday, which was also
Mm,
quite beneficial.
Wow, Monday to Friday. Wow.
Yeah, and I'd worked shifts all my life, so it was nice to do something, even though it was longer hours. It was a challenge to take on and set up a service from scratch,
And
really.
how do you think your role has evolved and changed? Because one of the big themes of National CNS Day this year is demonstrating the evolution of the CNS role. So how do you think your role in the service generally has changed?
Well, for one, I was on my own in the beginning, and so that was quite hard, and that was for several years. And over the time, we've recruited a couple more CNSs and a support worker, and from when I worked in the beginning, obviously that comes with experience to some degree and what you can take on yourself. But we now run nurse-led clinics. We do video clinics since COVID anyway, where we can talk to patients without them coming in. We support the consultants, but some of us, once we're able to, we can see patients on our own and break bad news. We have breaking bad news clinics. We're very autonomous, and I think over the years that has grown, if I'm honest to say. But that does also come with experience, because as you've probably had a discussion before, CNSs are very rarely employed as a CNS, so you have to grow them, and they tend to be ward nurses that come into the role. So when they first start, they're not able to do the things that you can do 2, 3, 5 years down the line. So as well as the role evolving, the person has to evolve as well.
Yeah. Chelo, how did you become a CNS?
Right, to start with, this is my 7th job. I've been a nurse from primary, secondary. Like I work in, my background is actually is A&E nurse, and after that, I work in neurosciences as well. Then I work in district nursing, which is I see a lot of challenging patient, and then I kind of wanted to settle down. I'm so very mobile. I don't stop. So after that, I then working in hematology oncology just to find my way. I don't even know what I'm doing. So hematology oncology is the one that like giving, of course, as you said, giving medication, chemotherapy patients, and everything like that. Now, I just found it quite very interesting because I treated loads of tumor sites, all the tumor sites. I treated them. I give them chemo, but I don't have that feeling of okay. I know my patient. I can talk to my patient, but it's different. Something's missing. So I said, like, how about doing something different? So this kind of sentences work. It's open to me. And one of these consultants said, Chelo, maybe you're good to have another kind of job, maybe a clinical nurse specialist. Maybe it will give you some more, satisfaction. I don't know what I'm going to do. I'm so very unsettled. I just in and out. As I said, this is my 7th job. Then I tried this secondment thing, the upper GI 2017. And that was only like a secondment, and then after that there's no money. I sent it back to chemotherapy unit, but I didn't stop there. I want to be a CNS, something that I want to do more, because I'm hanging just 2 years is not enough for me, because to be a CNS is not just a year, 6 months. It's kind of every day is different, and you can just be a CNS in 2 years. You have to do more. You can't be, it's so I cannot explain how it came, how we do the work came. It's very, very, it's so personal. It can become unique. It can be personal, because com- comparing to a regular nurse, I didn't say regular nurse and clinical nurse specialist, they're so different. There's no one can be sitting next to me, a regular nurse, to be SNS as well in one day.
Yeah.
It's so difficult. And become to be SNS, well, this is my pathway really. My chemotherapy experience in oncology department is my pathway to become a clinical nurse specialist, which is I get focus on the upper GI, which is before I just treat any cancer patient. But this time I focus to one side, which is the upper GI, pancreatic, liver, or something. It's just So this is what my journey is, and I
Is
want
it
to stay here until my retirement.
so? Is it that like all nursing? Like we know, I'm
Yeah.
married to a nurse. A cancer nurse. Like nurses are are phenomenal people across the board, aren't they?
Mm.
But is it that real ability to develop the personal relationships that makes
Yeah,
what you guys a little bit
Yeah, I think
different
so. Yeah.
it,
and a bit
it
more special for you guys to work in that field?
it is quite unique feeling. You see a patient in the room having this breaking bad news thing. It's kind of connection, like you have like I don't know if you involved with fraternity or sorority when you're younger, Steve,
No.
but I used to be. I used to be in a gang area or something, maybe even back on my place in Philippines, all right? This is kind of feeling that when you see a patient, and this feeling is quite special, you know, seeing them and then few minutes and the trusting, the support, the nurturing is there. It's like in there. It just is. I don't know how I explain it, but it grows to me really uniquely, and I don't know. It's not an easy job, but it's. I think it's a calling. I think
Yeah.
it's a calling that you get. I don't know how to explain, but yeah, I call it a calling.
Yeah, but it must take Kim. It must take a real certain skill set and a certain person to really excel in this kind of role.
You have to really want to do it. You
Mm.
have to really have an interest in the specialism that you're in, as well as
Mm.
being cancer. But like for me, it's neuro and, whatever speciality you're in. And you have to want to be able, or you really have to in this, be able to go that bit extra mile, I think. You want to go a bit beyond what you want to do your very best. And so maybe you do need to be a bit special in it, I suppose. But it's difficult to say
Yeah,
when you're doing it yourself. You have to be a bit humble, don't you? Really?
Well,
yeah,
No, you are very
let's ask
special,
Peter.
ladies.
Yeah.
Yeah, let's ask Peter. Like, what are the skills that you see in Chelo and in these guys that are so special to patients?
I think it's all done, not like you say. It's not just done over a couple of days or a couple of weeks. This is experience gained over many years, hard work, and you just excelled at the end. I'd to say I've heard a little bit about your journeys, but you are very special ladies. You can't
Thank
say
you,
nothing
Peter.
else
thank you.
because
Yeah.
you do. You are doing a very special service to not just me, but to loads of people, and
Mm.
you're helping them just make their journey so much more comfortable. And say, with all your experience, you know the right things to say, and you know the not the wrong things to say. Yeah, if you know what I mean.
Yeah.
But yeah,
Yeah.
Yeah.
and it is you don't do that over a couple of weeks. That's experience gained from being very hard working ladies, which you are.
Mm.
Yeah.
Okay. I
What an
think you do.
incredible thing.
Oh
Thank
no,
you. Thank you.
definitely,
Yeah.
definitely. Yeah, I don't. It would make my journey so much harder if I didn't have Cello, just to be there to answer any of the questions that me or the wife have. So you'd be just going to try and survey the journey by yourself. But now you've got someone special who's mapped it out for you. And I was always been of when I used to work, everything was set in stone, and I wanted to know this, and this straight away. But whereas with cello and that, they sort of ease you into everything. It's not
Yeah.
dum 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 dum. I knew that I
Yeah.
had to be up
Yeah.
at 5:20 in the morning to leave by 22. Otherwise, I'd
20
get
past
caught in the
5, Peter. What were
traffic.
you doing? What
Driving
job
to
were you doing?
work, I was an asbestos surveyor,
All right. Okay.
so it
20
could
past
take
5 is
me.
a bit brutal.
Oh no, that was a lie-in.
Was
Yeah, if I was driving, it depended where my journey took me. Sometimes I was driving for 3 hours before I even started work.
Mm.
And I'll
Because
bet if I ask Kim and Cello, just to kind of wrap this up, I'll bet if how many patients are you giving this level of care to at any one time? How many patients are sort of on on your roster? Because I bet to Peter it feels like you are the only one.
I would say it's a couple of hundred in.
A couple
Yeah.
of hundred.
Really?
Yeah.
I mean, we have more than that, but
Wow.
some of the patients. So it will be many more than that,
Mm.
but many go back to their other hospitals in our instance. But people that are say just on our books in oncology
Mm.
will be at least per nurse is about 100. But
Isn't that
obviously
Yeah.
people are at different stages. And
Yes. So
some sorry, Chelo,
good.
some nurses will have more or less. So for us in brain tumor cancer, we have less patients because it's a much rarer cancer, but their intensity is greater. But you might then have nurses who will have a lot more on their books because it's a common cancer, like breast cancer, for instance. But
Mm-hmm.
the intensity of those patients comes and goes, as it were.
But Peter, what an amazing thing to make you feel as special as she makes you feel, and yet they have so many patients to look after, and I bet they all feel like that.
Oh yes, you'd like to think so.
Yeah,
You'd like to
I'm
think
sure they
so.
do.
Yeah, I didn't realise it was that many patients that they would be looking after.
That's
Sounds
incredible.
quite mad. Oh yes, and yeah, to give the individual help, and you feel a special person. I
Yeah.
feel like Chelo's she's my little lady. So Cello,
Individual.
am I an
Yeah.
easy patient then?
You are, because you're listening and you are cooperating. Some patients, we have to chase them.
Oh,
We have to
okay.
chase them. We have to do this. We have to do that. And then when we got patient like you, it's kind of easy as well for us to follow you, because you got Donna's listening. And then whenever we say, Mr. Adams, this one, this is what we're gonna do, you're there and you're easy to reach. But
Yeah.
some patient, it's so difficult chasing them, and we just don't stop until we have to talk to them. And yeah, thank you.
They are,
One of
Peter.
them.
There you go. You're an easy patient. Well, listen, that is a nice way to wrap up. Thank you so much to Kim, to Chelo, to Peter. Like, you've all been absolutely wonderful, and I know, yeah, I'm sure that anybody listening will have got a real good impression of why these two women and all of their colleagues are, and not just in Northeast London, I guess, all over the country. CNS is doing such an incredible job. So thank you on behalf of all the Peter and on all the patients that you guys work with. It's an amazing job that you do.
Like
Thank
you
you.
say, they are
Thank you.
angels. They are angels.
Thank you, Peter.
You're
Kim,
welcome.
Steve, thank you so much.
Thank you, guys.
You're welcome.
Okay.